I am Abhisha, MSc Nursing second year in Vivekananda College of Nursing. Now we are going to see about the female pelvis. So the female pelvis is an basin shaped organ. So the basin shaped cavity protects the bladder, rectum and then internal reproductive organs. So the pelvis is an virtually incapable independent movement except during the childbirth. So the female pelvis is having the say about the bones, joints, ligaments, landmarks and then diameters. First we will discuss about the bones. The bones are divided into three parts, that is innominate bone. The innominate bones are present in right and left side. So two innominate bone, one sacrum and then one coccyx. So the innominate bone is having the three divisions, that is ilium, ischium and then pubis. So the ilium is an upper and lower part of the pelvis. So the innominate bone is the hip is rest in the iliac crest. This part is called as an iliac crest. The iliac crest is having prominence. So front of that superior part prominence is called as an anterior superior iliac spine. Just below part is called as an anterior inferior iliac spine. It having the same opposite end, posterior superior iliac spine and posterior inferior iliac spine. So the large flared cavity is having small concave shape, that is called as an iliac fossa. And next one is an ischium. So in that ischium is an lower part, anterior lower part. The lower part is having the part of the large oval shape is called as an obturator foramen and the cup shaped cavity is called as an acetabulum. The acetabulum is an joining of the femur bone. And next one is an it's having large prominence, that is an ischial tuberosity. It helps for sitting just behind the spine or present, that is called as an ischial spine. The above ischial spine part is called as an greater sciatic notch and just lower part is an lesser sciatic notch. And next one is an sacrum. So the sacrum is an wedge shaped cavity and it is an 5 fused vertebra. The upper part of the sacrum is called as an sacral promontory. So the sacral promontory is articulating with the 5th lumbar vertebra. And next one is an coccyx. So the coccyx is an vestigial tail. It is an 4 fused vertebra. During the childbirth it is having the moving. And next one is an joints. So totally 3 joints are there, that is sacroiliac joint, sacrococcygeal joint and then symphysis pubis. So in that sacroiliac joint is an joining of the sacrum and then ilium. And next one is an sacrococcygeal joint. So in that sacrococcygeal joint, joining of the sacrum and then coccyx. So next one is an symphysis pubis. So in that symphysis pubis, above part is an superior ramus and lower part is an inferior ramus. It is an arch shape. 2 pubic bones are joined in the symphysis pubis. So totally 3 joints. And next one is an ligaments. So 4 ligaments are there. First one is an sacroiliac ligament, that is uniting the sacrum and then ilium. And next one is an sacrococcygeal joints, that is uniting the sacrum and then coccyx. And next one is an sacrospinaeus ligament or sacrotuberous ligament. So that is an connecting of the sacrum and then ischium. And next one is an interpubic ligament, that is uniting the 2 pubic bones. So totally 4 ligaments. First one is an sacrococcygeal ligament, sacroiliac ligament, sacrococcygeal ligament, sacrotuberous or sacrospinaeus ligament and interpubic ligament. And next one is an landmarks. So totally 8 landmarks are there. First one is sacral promontory, sacral wing or ala and sacroiliac joint, iliopectineal line, iliopectineal eminence, superior ramus of the pubic bone, upper inner border of the body of pubic bone, and next one upper inner border of the body of symphysis pubis. So that is an landmarks of the female pelvis, and next one is an diameter. So in that diameter we have three divisions, that is inlet, cavity and then outlet. First one is inlet. So in that inlet, first one is an antero-posterior diameter. So in that antero-posterior diameter means sacral promontory to the upper border of the symphysis pubis. It's having three divisions, that is anatomical conjugate, obstetrical conjugate and diagonal conjugate. So in that anatomical conjugate means sacral promontory to the uppermost point of the symphysis pubis, that is an 12 centimeter, and next one is an obstetrical conjugate, that is sacral promontory to the upper inner border of the symphysis pubis, that is an 11 centimeter, and next one is an diagonal conjugate, that is sacral promontory to the lower border of the symphysis pubis, that is an 12 centimeter. So overall the antero-posterior diameter is an 11 centimeter, and next one is an obstetrical conjugate. So in that obstetrical conjugate means one side of the iliopectineal eminence to opposite side of the sacroiliac articulation, that is an 12 centimeter, and next one is an transverse diameter, that is an right angles of the obstetrical conjugate, that is 13 centimeter. So in that antero-posterior diameter is an 11 centimeter and obstetrical oblique diameter is 12 centimeter and then transverse diameter is 13 centimeter, and next one is an cavity. So the cavity is an circular shape, there is no any exact measurement, but the overall antero-posterior diameter, oblique diameter and transverse diameter is considered as an 12 centimeter, and next one is an outlet of the female pelvis. So in that first one is antero-posterior diameter, that is sacrococcygis to lower border of the symphysis pubis, that is an 13 centimeter, and next one is an oblique diameter. In oblique diameter means abdurator foramens to sacrospinaeus ligament, that is an 12 centimeter, and next one is an transverse diameter in between the two ischial spines, that is measured as 11 centimeter. So in that outlet antero-posterior diameter is 13 centimeter and oblique diameter is 12 centimeter, and next one transverse diameter is 11 centimeter. It having small keywords, that is we divide 3 columns and 3 rows. First one is an inlet, cavity and then outlet. So in here antero-posterior diameter, oblique diameter and transverse diameter. So in that inlet of the antero-posterior diameter is 11 centimeter, oblique is 12 centimeter and transverse is 13 centimeter. So in that cavity all things are only 12 centimeter, and next one is an outlet, antero-posterior diameter is 13 centimeter and oblique diameter is 12 centimeter and transverse diameter is 11 centimeter. And next one, the pelvis are divided in two pelvis, that is true pelvis and false pelvis. So in that false pelvis means there is no any clinical significance in midwifery, and true pelvis means that is considered as an these parts, that is prim, cavity and then outlet. That's all about the female pelvis, that is an bones, joints, ligaments, landmarks and then diameters. Thank you.